Hello everyone, my name is Baylie Gibbons and I am going to be presenting our research that was conducted by myself and a few other colleagues, including medical students and residents. Our research is called Identifying Interventions for Recruitment of Women into Medical Residency Programs, a Scoping Review. We began this scoping review because diversity, equity, and inclusion continues to be an important topic in medicine and has gained increased attention in the last decade. Matriculating medical school classes have shown equal gender distribution since 2013, according to the AAMC, yet significant gender discrepancies among residency programs continue to persist. We investigated several specialties and their interventions to increase representation of females in medical residency programs. Our objectives of the scoping review included 1. To identify types of interventions implemented to increase female representation in medical residency programs, and 2. To identify if those interventions positively impacted female representation in medical residency programs. Our methods included a comprehensive search which was performed in PubMed, Scopus, Embase, and Web of Science and yielded us 1,663 articles. Search results were then screened in a masked and duplicated fashion for inclusion criteria. The inclusion criteria was that it must be published in the English language, studies completed between the years of 2018 and 2023, all within the United States, and studies that addressed residency programs implementing any intervention to increase female recruitment. Data was then extracted in a masked and duplicated fashion from the 28 articles that met the inclusion criteria. In a results section, you can see our flowchart that shows how we went about our screening process. Starting with our 1,663 articles, we had 94 duplicates. After those were taken out, we had 42 that were yielded from our first screen of only the inclusion criteria. After our second screen of those 42 articles, we ended up with 28 articles total for our entire data extraction. On the right-hand side, you can see the pie chart shows the types of study designs that were included, which were quality improvement, surveys, systematic reviews, retrospective database, cross-sectional analysis, and cohort studies. Table 1 is a summary of our findings, which showed the types of specialties that were included in the articles. Orthopedic surgery was the most common, but there were other surgical specialties included in those with other random specialties that were sprinkled in. We have our subjects, which most of the articles included both residents and faculty. Some were just faculty, some focused on just residents, and some focused on medical students. Within all of the articles, 57% of the included studies all had one common intervention, which was changing the faculty, whether that be adding more females in leadership or just adding more females in general to the faculty. That showed that there was more females that they recruited to their program. The next most popular intervention utilized was mentorships and recruitment within medical students. And then another popular intervention that was utilized was implementing a diversity and inclusion program within the residency. Of the included studies, 82% demonstrated a positive influence on female recruitment when the interventions were implemented. In conclusion, while the ongoing challenge of attaining gender equality in medical residency programs persist, we have identified interventions that point us toward progress. Ensuring equal representation of women across all medical specialties is crucial for enhancing patient care, fostering diverse perspectives, and it is our hope that this scoping review equips residency programs nationwide with the necessary tools to implement interventions and increase female representations among all specialties. Thank you so much for listening.